Hello, I am Dr. Brown, and you are? Okay, nice to meet you. Yeah. Get your paper here. And just remind me of the year you were born, please. That's correct, okay. Alright, so what brings you in today? Okay, you'd just like to get your skin assessed. Okay, well you are in luck because I specialize in the face and the skin on the face, as well as facial surgeries. Some more serious than others. Okay, so and I can see in the notes here that you were interested in a custom face mask or face regimen. Okay. Yes, that is no problem. I can do that for you. I will have to take some swabs, as well as use the information I gather from my assessment and just any findings. And I will come up with your personal skincare, personal face mask. That is what we offer in the office at this time, the face mask. Okay. So doing okay overall? Okay. Okay, so from first glance at you, you're wearing makeup, aren't you? Mm-hmm. Okay, well I'm going to have to take that off. Alright, how about we start with any concerns you may have for your skin? Let's start with that as I remove the makeup. Damage from the sun. Okay. Do you get sunburnt often? Use this toner to clean you off. Do you wear sunscreen? Okay. Okay. Well, thinking that you might need a higher SPF if this keeps happening, as well as you need to reapply the sunscreen every couple of hours. They do make patches now that you can put on when you apply your sunscreen. It'll go clear, but then when you need to reapply the sunscreen, it turns, I've seen purple. And that is an indicator of the sunscreen has worn off. So those exist now. That's pretty helpful. But it is like every 2-ish hours, I would say. It's probably best to reapply. Yes. Do you work in conditions that are outside? Do you spend a lot of time outside? Okay. You good? What SPF did you say you were wearing? Yeah, for everything you're telling me, I would maybe increase that just slightly and increase the application. But I will look at your skin better. Okay. I'm going to start with my light, and then I will probably touch around your face. I'm just gonna visually assess what I can see here. We want to make sure. Okay. Yeah, I can see along the hairline and the top of your forehead there that you've probably experienced quite a few burns. Now, I know this is kind of like the dentist office where you may feel the need to lie about how much sunscreen you're applying or if you're applying it. You know, when dentists ask if you're flossing or not. Yeah, it's a similar situation. So, if you're lying to me, that's okay. I just concerned because we do not want to develop melanoma or any further damage. So you've got some scarring along the side here. That's okay, I do too, honestly. Do you have anxiety? Do you tend to be a picker? Yeah. Okay. Again, nothing out of the ordinary. Let me check your nose. The usual. Just a couple of blackheads. The bridge. And the top there. Okay. If you'd like, sometime we can do an extraction. Alright. Yeah, we'll save that for next time. Can you tuck your lips in for me? Thank you. Just gonna assess the skin around your lips. Dryness. Do you experience that? Around the eyes. Okay. Yeah. I think the toner helps to moisturize it a little bit. And it's hydrating, so it makes it a little difficult for me to see, but as it dries, it'll be easier. Okay. Okay. It's just and your cheeks. Okay. Do you find that you have combination skin? But that just means you have some dryness and some oiliness in spots. Or you either experience dryness or oiliness. It's like a scale, you know. Oily, combination, dry. I can see up here in the T-zone you have some oiliness that's residual after the toner, but it's like chin too. Okay. Alright, I'm just not noticing that right now, probably because of the toner again, like I said. But okay. Alright. Yes. Okay, so like I mentioned, I noticed the acne scarring. Do you experience acne at, higher volumes during, a month? Or, is your skin overall pretty clear? Okay. Let me just get a feel for your skin before I put gloves on. I'm going to sanitize my hands, so I don't have to worry about that. My hands are clean. They have to be. I'm a doctor. Could you imagine the trouble I'd be in? Oh gosh. Okay, just going to feel along your forehead. The sides here. And your nose. Close your eyes for me as well. I'm going to run over your eyelids. A little oily there. Okay, feel around your eyes now. Okay. Lift your head for me. I want to see what the skin is like under. Okay. Okay. No, you put your head back now. Alright. Proceed with the gloves now. Okay, I've got what I needed to. The sun damaged the main concern today. Looking. Okay, yeah, that would. We do have face masks we can come up with that will help, infused with aloe and such to help moisturize those areas as well as cool them off. So if you do get another burn, it'll be helping right away. Okay. Gotta be very careful. I have long nails. Don't want to pop these gloves. Okay. So, we need to take some swabs as well. Alright. Got these ready for when I need to do that. But now I'm going to feel the structure of your face, okay? So I'm just going to make sure everything feels right. Some people come in here with a broken nose and they don't even know it. Okay. Feel along the temples here, the sides. Okay. Your jaw. Can you open and close your jaw for me? Okay, do you experience TMJ? Do it again, please. You might. This side might be a little off. Okay. No, that is something we can work on as well later. Okay. Brow bones. And close your eyes for me. I'm just going to feel the bridge here and then run over your eye. Okay. And your cheekbones. Okay, I'm going to now test the resilience of your skin. Okay, I'm going to see how quickly the blood flows back to it, and just the elasticity. I'm going to poke you in a few areas. Okay. Okay. Thank you. Does any of that hurt when I do that, aside from, the obvious being poked? It's uncomfortable. No, and nothing hurts anywhere else where I've touched your jaw when you opened it. Did it hurt? No. Okay. So everything seems good here. We'll just keep the focus on the skin today. Okay. Alright. So, since you're new to this office, can you just tell me, have you had previous warts on your skin, rashes, moles, specifically in the facial area? Because I am a face doctor, that's my region, okay? Mm-hmm. And no serious injuries to your face as of late. Okay. No cuts, even. Okay. I'm just going to run this over your skin here. We'll keep this one to the forehead and the temples, alright? Really need to coat it. We'll go along the hairline as well. Okay. Okay. Put the sample on to the slide. Place that on the microscope. Give me 1 second. I'm going to put the rest in here. And this is just for the lab to do further testing. Okay, prepare the second one. I'm also going to take some of the dry skin around your brows and your cheekbones as a sample as well. Okay, it's all part of it. Helps us formulate and whatnot. Okay, now like I said, we'll keep this one to the lower part of your face. So we'll go over your nose, and then your cheeks and your chin, okay? Alright. Do a little bit more on your chin. Perfect. Now, it's important that you trust me, okay? It's just important. If you didn't trust me, we would have a problem, okay? as well. Let's see. Okay. Let's try the other one. See what we find. Have you had an assessment like this before? Not as detailed. Yeah. It's not a service we talk about very often. Okay. Two different reads when I zoom in and zoom out. Pretty odd. Okay. But no, I'm sure we can still work that out for you. Let me just put these to go to the lab so someone with a more trained eye can look at that for you. Not that I'm not trained, but I don't work in the lab. So those can go off to the lab. And I'm going to need one of these. Okay. So like I said, around your eyes. I'm going to take the samples, okay? It's not like you have giant flakes of skin hanging off, but I'm taking what I can see. No need to be offended. I have the same thing going on, honestly. And so do a lot of other people. So it is common. Okay, that'll do. Go to the lab as well. Josie. Yes, hello. Can you take those samples for me? Thank you. Alright, Josie will have those looked at right now. And while we wait for her to come back with those, I'm going to take some measurements and we can go over what I assume the formula is going to be, okay? Okay. So, let's just see. Okay. Okay. You have quite a symmetrical face. It's very fascinating. Oh yes, trust me. I've seen some. Ooh, but no. Yours, quite intriguing actually. In the best ways. Okay. And we got oily, dry, scoring, some damage. Okay, so all right. So, yes, Josie. Perfect timing. Can I see those? Okay, that all checks out. Thank you, Josie. Alright. So, the mask we are going to mix up for you today is going to be a combination of cocoa butter, lavender, green clay, and this volcanic clay we have. Okay, so these are the additives I'm going to use. There we go. These are the additives. And we do also have peppermint. I guess that would be good for the cooling, especially if you experience a sunburn aspect of it. I might do a drop of that as well. So, here. And these are essential oils, okay? So it's going to have natural healing powers. Okay. And I basically just mix it in here. And you're good to go. Okay? But we will try it on your face, assess how it goes. Make sure no crazy reactions. Alright. We don't want to send you off with a mess, you know. Make things worse than they were. Alright. I'm going to start with the drops here. 2 lavender. 1 peppermint. I have to change this in the notes that I'm adding peppermint as well. Okay. It's the lightest smell. The cocoa butter smell really takes over there, but these are mainly to help with their more natural healing aids, I guess you could say. Now we want half a scoop of the volcanic. I know, it's fascinating to watch, huh? It's all mixed in office. Volcanic. Then we need, let's say, 1/2 to 3/4 of the green clay. The French green clay. It's fancy. Oui, oui. Okay. Don't want to go too overzealous, you know. Drop that in there. a moment, please. Add to the notes before I forget. 2 drops. Okay. Now, this is easier to apply when it's been a little warmed, okay? So I'm going to hold it quite firmly in my hand so the warmth from my hand helps the cocoa butter be easier to mix, okay? I'm not hiding anything from you. It's just how it works. Science. I'll show you once I've gotten it warmed up enough. Okay. This takes a lot of focus, okay? This is what I was talking about earlier, the trust me. You have to trust me, okay? It's working though. Alright, so we're getting there. Do you see it? Do you see it? Okay, great, perfect, glad you can see it. Now, we're going to use a bigger spatula, as this is just a little stirring stick. And we will apply some of it to your face. Do you have any reservations before we do this? No, you shouldn't have any, but I just like to ask. You know, there you go. There's your mask. Hand mixed. You sure? Okay. Alright. Now sit still for me, please. I'm just going to apply this to a small section of your forehead. And by a small section of your forehead, I mean the whole forehead. That's just how I work. Okay. Now we wait just a couple of seconds. Is it tingling? It should a little bit just because of the peppermint. But, no like burning sensations, correct? Okay, alright. Well, I think we can proceed then. We'll go down your nose. Close your eyes if you're worried about me getting this in them, although I'm a professional, so this should not be a worry, but I understand everyone's got anxieties. Your cheeks now. That's good. That on your cheeks. Tuck your mouth in for me again, thank you. Just good. Mouth. Chin. Okay. Gotta go a little better between the eyes here. Just a little bit better. Okay. Still doing okay? Okay, perfect. So, yeah, you're just gonna sit with that on for about 10 minutes. But I'll finish up with you and then you can wipe that off, okay? We'll just go over everything again. So that is a lavender, peppermint, green and volcanic clay mask, okay? Probably won't be able to find that in stores, so you might have to come back here to have it mixed. But, just gonna label that for you. Right. Okay. And we will have Josie write on it. My handwriting's not the best. We'll have Josie write on it. Still doing okay? Okay. So the main areas I'm going to show you on our friend Dylan here. The main areas that I wanted this formula to focus on, like we talked about, is the forehead, okay? Because you have some sun damage that's up here and even a little bit along your cheekbones there, just because those are the parts of your face that stick out the most when the sun's coming down on it, you know? So this mask will help with this area and these areas as well. And we wanted to have something that was friendly for oily and dry skin. So that'll take care of your T-zone. Okay, T-zone. And your eye area. So the oily and the dry. Perfect, perfect. And it'll be friendly to the scarring along the sides here. It not necessarily gonna do anything to help that. That would be more like of a dermabrasion type treatment, which again we could do. Pretty much anything with a face I can do here. Okay. I've constructed faces from being broken into like shattered pieces. Some were even missing and I made it work. Okay, it just, trust me. This is why you should trust me. But the sun damage is something we want to pay attention to now, okay? We don't want it to get any worse because that'll start giving us concern for skin cancers, okay? If you see any moles popping up on your face, and then, you know, changing in shape, anything like that, we should pay attention to those. It could be the first sign. Okay, so showed you everything on Dylan, and we know that, you know, your eyes are pretty dry. It's something, like I said, something the mask will touch on, as well as a T-zone and those sun damaged spots, okay? Any other questions, concerns, feedback? Okay, okay. So, yes, we can do a more in-depth measuring session if that's what you'd like in the future, as well as, you know, construction things, anything you'd like to talk about. We can focus on the TMJ thing as well. Do some adjustments for that. Okay, okay. Well, I thank you for trusting me with your face mask and your face overall. Let me shine the light one more time to see how this is drying. Depends on how thick of a layer you apply. You might be able to wipe it off a little sooner. I did a pretty thin one just to be sure. Okay. Okay. It's good to take off. We'll do that now. Okay. So I'm just going to take more of that toner. It's just going to provide some moisture to help remove it. Okay. And we'll just start along the forehead again. The cheeks. And your nose. And along this side here. Comes off pretty easily, yeah. Just a couple of spots that need to be gone over again. Okay, alright. So you're all set to go. Again, thank you for choosing this office. Thank you for choosing me, trusting me with this appointment. Here is your face mask. Okay, you may take that with you. I would say use it maybe twice a week if you're experiencing a sunburn. Maybe 3. Okay, that will definitely help with the redness. So. Okay, and like we talked about, increase the SPF just a tad. Maybe also invest in some sun hats or things that can help shield you a little bit better from the sun. I know it's, you know, sun's out, buns out, guns out, whatever, you know. Not those these kinds, the guns, you know. Okay, fun's out, you know, anything uns out in the sun. Just protect yourself, okay? Alright. Yeah, that's everything. You can be on your way. Josie will check you out. Again, have Josie write on there. She'll see the notes. And I'll see you back for a further assessment, measurement, extractions. That's what we talked about. Yes, you can schedule that with Josie as well. Okay. Okay. Well, I will see you again soon. Alright. Thank you. And bye. Okay? Okay. Hello. You're asleep. I mean, I know I can take a while to get into the room, but, okay, well, you're here for some extractions and measurements today. Okay. As you can see, I have my assistant Josie in here. Okay. She's going to be taking notes for me. So I can just keep moving with what I have to do. So I remember from last time custom face mask. Have you been using it? Okay. Okay, it's gone. Mm-hmm. Okay, I'll have the front make you the same thing over again. That's if you want it. Do you want it? Okay, yeah. Because just visually looking at you, I can tell that it has made an improvement since I was looking at the pictures that were taken last time. I can see a difference. I seem to have forgotten my light, so we're going to have to use a little makeshift one here. I'm just going to start by assessing your face. Okay, like usual. And it can pretty much be up to you when we do the measurements or the extractions. The extractions can be a little painful. So maybe if you want to start off easy, we should measure first. You're okay with that? Alright. Let me assess what we have going on here. I'm going to start by touching your face. Is that alright? Okay. Just going to feel around. Is there any pain as I do this? Okay. Any irritation? Your dryness cleared up from what I can see. No pain anywhere. Okay, I don't see any like visible acne left over, but I just wanted to make sure there was nothing under the skin because we don't want to aggravate it further. Okay. Okay. Okay, I think we can move forward with the measurements and poking at your face. So, you feel that everywhere, correct? This is the same as this and this. Okay. Close your eyes and tell me when you feel this, okay? Mm-hmm. 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 Yes, that was 2. Okay. Good. Sorry, Dr. Brown is having some issues today with their throat. It's a little dry. The air is kind of dry, so doing some excessive gulping and probably going to need sips of my drink, so excuse that. Okay. Like I said, we'll measure and then I will clean your face before we start opening the pores and everything. We don't want stuff seeping in. So I'm going to set this against your nose, okay? And I just need you to hold still, please. Okay, we've got 3 on the left eyebrow, the right eyebrow, sorry. We've got 3 on the right eyebrow. 3¼ on the left. Two and a half inch nose. You getting this, Josie? Okay, because you don't seem to be paying attention, so. Okay, the length of the face is 6½. Okay. Now, top to bottom, 8. Okay. Two and a half for the right eye. Two and a half for the left eye. Okay. Mouth is 3. To the nose is 2½. Okay, and I'm going to just get your ear over here. 2½ for the left ear. Okay, 2 3/4 for the right. Nothing wrong with that. Your face, nobody's face is symmetrical. Okay, nobody's. Alright. Space between the eyebrows is 1 inch. Alright, Josie? Mm-hmm. Now I'm going to get your jaw, alright? We're just going to set this over here. From ear to jaw is 2 inches. Corner of the jaw to the chin is 4. Looks about the same on this side. Maybe 4 1/16. Okay. Now, I'm going to just measure just to confirm. Now, Josie, I'm going to go down the line the same way I read it to you the first time, okay? Mm-hmm. If I say mm-hmm, that's the same, okay? It's the same. Mm-hmm. 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 I expect it all to be the same, honestly. Mm-hmm. 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 Add a 1/16 to the jaw on the right side. Just to be sure. Mm-hmm. 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 Yeah. Yeah, we're good. The jaw was the only difference. Mm-hmm. So I have to double check. These rulers do not measure the same, even though they are made to measure the same. It's really confusing. Okay, I'm going to bring this light in now. I need you to just pick one of the decorations behind me. There's a ghost right there that you could look at. I'm just assessing the skin, if you would feel better, even closing your eyes. That would be good. Just gonna double check these pores here that we were the most concerned about. Yeah, the nose especially is. See between the eyes too, because I thought I saw something. Yeah, along the cheeks. The top there. Okay. Have you noticed anywhere else on your face that like really breaks out or feels like it's holding a ton of gook? Okay. Pretty much just the nose is what's bothering you. That's a common problem area. Yeah, sometimes we see people with blackheads like right in their ears. You can't see that though. That would be something I would tell you about if there was a problem. But there's not. You're in luck. Okay, so this is just the simple cleanser we're going to use to remove any topical oils, any molecules of dirt, bacteria. Tuck your mouth in for me. I'm going to get under your jaw as well. Okay. I'm going to just let this soak a little bit more in your nose. Okay. Very good. I don't know what it is about this office. It is just so cold all of a sudden. Okay. Now, look at my extractions kit. I think we're going to be doing quite a bit of pressing on your face with the tools I'm going to use. I'm not really going to use the tweezer ones. They can cause scarring. All of these can actually cause scarring if someone who doesn't know what they're doing is doing it. So, we're in good hands here. Now, if Josie were the one doing this, she still hasn't mastered how. So, let's see, we're going to use this one and this one. I might even need the pokey one. This one just breaks the top layer of skin gook that's covering the blackhead from escaping. You don't have too many whiteheads, so you don't have to worry about that. I'm going to use this mister to open your pores first, okay? Don't want to leave it in one area for too long because we don't want it to burn your skin because it is quite warm to open the pores. Okay. So my area of concentration is the top of the nose and the sides. Even in the crevices, it can get pretty bad there. Okay. Good with that. So I'm going to go around first with the one in my hand. The one in my hand works. We're going to see what comes up when I gently but firmly drag this down your nose, okay? The pressure helps push everything out. And then I'm going to wipe it off, okay? So we're going to press and drag. Press and drag. Now the superficial stuff is definitely coming out. But there are some that look quite big that are deep in there, so we'll get in there with that. Okay, I'm going to move your nostril over and just drag along there, okay? We're gonna get in the crevice. Like I said, we want to make sure we pull everything out. Same thing on this side now, okay? And if it's a little painful, you can hold your breath, okay? As I do it, and then slowly let it out. And just not right in my face, okay? Kind of like do it down or something. Alright. Okay. There we go. Okay. Let's try this more concentrated side. It's got more surface area, so it will push for a little bit longer. Go down the side. Okay. Bring the light back in real quick. Okay. Yeah, so I'm going to use the poker. You're okay. Just sit still. You've trusted me for this long. So I'm just gonna open some of these bigger ones here. Do on the side. One to get two, and then two over here. Okay. And then using this tool, I can press. So we're going to be pressing and not dragging with this one, just pressing to try to coax it out. Alright. Press. Release. Press. Release. Josie, are you watching this? Yeah, I didn't think so. I can hear TikTok over there. Press. Release. I can't sign off for you to get further education if you don't pay attention to what's actually going on in the office. Press. Release. Press. Release. Thank you. Press. Release. Make sure I picked up everything there. Okay. So we don't want to do too much today, but we did clear you out quite a bit. Okay. if we kept going, your nose would definitely become inflamed, and we do not want that because it will take longer to heal because we are aggravating it, so it will need time to heal. Do you have a cooling moisturizer or any sort of cooling face product? Okay, if you don't, that's fine. I would suggest icing every once in a while. Ice, not the frosting. Do not put frosting on your face. That would be bad for your skin and would do the opposite of what we want. So, just one last time here, I'm going to open your pores and then I'm going to take the cleanser and cleanse your face again because those are not all open wounds but open areas on your face, which again bacteria and things can sneak into. We don't want that. Okay, we don't want that. So we've opened the pores. Now we're going to open them again to clean them out. And then we're going to let them close, which shouldn't take long because the office is freezing. Because everyone else thinks that this is an acceptable temperature. It's not. It's not. I'm also going to apply a serum after we dab your face dry, okay? Just wipe it down again. Especially the nose area. This is cold, yes, so that will help feel better as well as begin the process of closing the pores. Okay. There's that. To pat your face dry, okay? You never want to drag. Don't drag anything on your face, okay? Pat dry. And then work products in upward or pat them in depending on the instructions, alright? Okay. Josie, did you hear about the face mask? We need another one of this patient's previous prescribed face mask. Okay, thank you. Josie will let them know at the front and they will do it. Okay, that's good. So we're going to use this Timeless Vitamin C Serum. It will help brighten the skin and supply it with vitamin E and ferulic acid, as well as hyaluronic acid. Yeah, like the ridiculous commercials. Yeah, so. Just a little bit of an orangey smell, okay? It is citrus. A little bit of my gloves here. It says to use 2 to 3 pumps. I don't even do full pumps when I was obviously just squeezing it out of there. It's pretty much just the equivalent of 1, maybe 1.5. Because while it does dissolve into the skin fairly well, doesn't sit on the skin. We don't want to overdo, especially this is the first time we're putting it on you, so we don't want to chance anything. Just slowly introduce it. Okay. it recommends after we've applied it to pat it in, pat it in. Pat it in, pat it in, pat it in. Okay. Remember upwards motions. There we go. Okay. So I believe we have done everything we said we would do today. Measured extractions. Did a little bit of a cleanse. The measurements, we'll just use those to monitor your face moving forward. And of course, if anything should happen to your face that is critical, where we'll need to reconstruct, we have the previous pictures, but we also have measurements now. So, we hope nothing happens to your face, but in the off chance something does, we have everything ready to go. So, it's just a precaution here at the office. Okay? Well, it was nice seeing you again. And I hope, the extractions help. Like I said, ice or a cooling moisturizer. They're probably going to be your best bets here. Do not add any new products right at the moment to your regimen, because we do not want anything aggravating your face. It'll just help narrow down if the extractions did not, if your face didn't like them, it'll help narrow down instead of adding products in them or wondering was it the extractions or the product. The serum I used is totally fine for this situation. If you are interested in it, you can get it up at the front, but I wouldn't apply it too soon, Yeah, just because we've already done it to your face and we want to, like I said, slowly introduce. But other than that, you are good to go, okay? And if you need anything in the future, let me know and we'll schedule an appointment. Alright, well, I'll see you around then, okay? Alright, bye. Hello, I am Dr. Brown. As you know, you've been here before. So, what can I do for you today? I can help you as long as it's something to do with your face, because I specialize in the face only. Just the face, nothing but the face. The face. Okay. Looking for some extractions. Okay. Well, I think it is time to do some remeasuring for you as well. So we're going to do that first and then get you prepped to do some extractions. Now, we did squeeze you in, so this is only a short appointment. Nose is looking the same. Oh, we also have to do imaging. We've begun taking better images of our clients, just in case you happen to need facial reconstruction surgery, which we hope you don't ever need. But you like horses, don't you? Horses are dangerous. Okay. Well, because you like horses, gives us an even bigger reason to take the imaging. So I'm going to flip this towards you. It does flash, just so we can see everything, okay? That's about right there. And I will need you to just sit still because I'm going to... Sorry, the offices around us are doing construction. Okay. Going to have to move the camera around and take from the side as well. Okay. Okay, thank you. So just sit still. No funny business. It's going to flash now, okay? Alright. Sit still. Don't move, please. Coming from this side now. Perfect. And this side as well. Great. That is all. That was it. Just helps us keep a catalog if anything changes on your face, you know, especially around this time of the year where it's warmer and the sun is out, and you might feel compelled to go outside without sunscreen, as Dr. Brown did. You can't tell too bad. It's actually not looking horrendous anymore, but Dr. Brown made the mistake the other day. It happens to all of us. And so just want to prevent things like sun damage, skin cancer, stuff like that. Okay, we'll be able to monitor that. Okay, now Dr. Brown is prepared to feel your face again. We just have to do the every time we have to check. And you said no falls, correct? No falls, no horse kicks to the face. Close encounter. I see. You want to be careful of the nose here. Okay, nose. And your brow bone. And the jaw. Go ahead and open and close your mouth, please. Good. Open and close your mouth again. Okay, open and close your mouth again. Raise your eyebrows up for me. Let them fall. Okay. And again, raise them up. And let them fall. Okay. So, you wanted extractions done today as well, just a quick round of extractions. Yeah, kind of getting them like freckles, I see, and along the nose. Common spot. Even Dr. Brown has them. It's not. Okay. Okay. I'll get those for you. Don't you worry. Okay, so I am going to be wiping your face down with this towelette just in the places we know. On the nose here. On the nose here. Okay. And that's just gonna add some moisture, open the pores. I'm going to use this tool to start, see if stuff just willingly comes out. Now if it doesn't, we're going to move on to my favorite tool, which is a little bit more aggressive, but remember to hold your breath during this because this can be quite painful. Take a deep breath in, let me do the swipe, let it out. You don't want to press too hard, but you also gotta be careful if you're doing it yourself. I wouldn't recommend it. Scars happen. Okay, ready? We're pressing. Take a deep breath in, press, and let it out. Okay, deep breath in, press, and let it out. Deep breath in, press, and let it out. And I'm gonna go along the start of the cheeks here next to the nose. Take a deep breath in, press, and let it out. Take a deep breath in, press, and let it out. Deep breath in, press, and let it out. Deep breath in, press, and let it out. You're quite the champ at this. Not too much is coming out, but we're getting stuff. Okay, ready? Take a deep breath in, press, and let it out. Deep breath in, press, and let it out. We've done what we can with this tool here. Put it away, have it sterilized for later. This one, great for plucking your eyebrows as well, but Dr. Brown doesn't specialize in that. You would not want Dr. Brown to do that. Definitely would be leaving a horrible review after the visit. Okay. So what I'm going to do, again, I'm going to press, and you can take a deep breath in and let it out when you feel it's necessary for this. But I press and then do a little bit of squeezing, and I pluck. Okay. I pluck the gunk out of your pores this way. So Dr. Brown needs to get a little bit closer. Dr. Brown would also like the office to invest in, you know, those magnifying glasses, but then I wouldn't probably be able to see. So, right, press, squeeze, pluck. Press, squeeze, pluck. Go along the side of your nose here now. Press, squeeze, pluck. Press, squeeze, pluck. Press, squeeze, pluck. Okay, I'm going to say that's good for that side. We don't want to aggravate your nose too much. And if there's anything we can't get out, we don't want to make it become, you know, more of a visible issue. Press, squeeze, pluck. Press, squeeze, pluck. Press, squeeze, pluck. Okay. Do you sleep on that side of your face? Mm-hmm. Okay, yeah. Yeah, I can tell. Okay. Oh, good. Let me wipe you down again here. Clean stuff up. I would recommend using a proper toner when you go home, just to make sure you've closed the pores, because if you leave them open, we're just allowing things from outside to get in there. Yes, so that was all the time we had for this quick visit, but you don't have to come in here very often, but I hope you aren't in here for anything much more serious anytime soon. Yeah. So, I'll see you when I see you then, okay? Alright, bye. Hello, I am Dr. Brown. I beat you into the room. Go ahead and get comfortable there on the exam table. Sorry if you hear outdoor noises. The office air conditioning broke today, and so the windows have to be open. It's super inconvenient, I know. Okay, so can you confirm your name with me here? I have my list of people I'm supposed to be seeing at this time, but a lot of the time people just come in kind of random, so yeah, some people try to get in earlier. Can't allow that. Last time we allowed that, messed up the whole day because everyone was upset they got pushed back. Well, because somebody had me remove a blackhead from their nose that they just couldn't leave alone. Okay. Yes, I have you right here. Okay, and there are notes on here about when you made the appointment, of course, but I can't be bothered to read them, so I'm gonna have you tell me again and I'll take some notes, okay? I apologize again for the window being open. I have no idea what they're doing out there, but it sounds like some crazy construction and some, I don't know if you hear that hum, but it sounds like a telephone's been disconnected. So, let's get back on track, okay? Your name, please. Oh my goodness, this is the first time I'm getting a proper look at your face. Okay, so let me reintroduce myself. I am Dr. Brown. I work and specialize in the face, just the face, the whole face, nothing but the face, okay? So, I'm a little confused why you're here right now. Okay, so your reason for coming in is that everyone else is telling you that there's something wrong with your face. Okay, could you be specific, because I'm not sure I see what they're talking about here. Okay. Alright. Okay. Here's off kilter. Not heard that before. One eye is higher than the other. Okay, and concerns with your pores. Okay. Alright, so perfect, because I was going to ask you about your concerns. So large pores. Okay, ingrown hairs. All right. Really? Oh, scarring. Okay, yeah. Okay. And I'm sorry, I interrupted you when you were confirming your name. Please spell it for me. Okay. Last name. And your age again, just so I can cross-confirm. Okay. And how about, do you have any allergies before we get started? Glove issues, any sort of oils, anything like that I should be aware of? Okay, perfect. Don't worry about that here. Do you have a skincare routine? Anything else? Occasional serum, okay. And do you use SPF at all? Okay. Alright, so I'm going to tell you right now that all of those things you've listed here, from a professional standpoint, none of those things are wrong, okay? I have seen plenty of face in my office, and I've even done quite a few surgeries to restore faces. I've had horrible trampoline falls, bricks, horse kicks to the face, things like that. And I do not believe that what you have said to me here is really much of a concern. Now, I do see the scarring on the sides. Dr. Brown also has that. That happens when you've got anxiety or other things that cause you to pick, and that is quite normal. So we can do something about that. I get that completely, wanting to see what we can do for that. But everything else that you've said, who again was saying this stuff to you? Oh. Okay, so like random people. And your jealous sister. Okay. Yeah, so I'm sure all of these things, the crooked nose, ears off kilter, one eye higher than the other, is just stuff to make you feel bad. You stoop to their level, okay? Now, I do have to say, this may be very unprofessional, but I do have to say that you have one of the most amazing faces I have seen in this office. Now, I have seen so many faces in this office that what you're saying to me is absolutely baffling that anyone would say this at all. Now, of course, I am going to proceed with the traditional exam of the face. Just because, gonna ask questions, make sure there's no odd lumps, bumps, or anything of the nature that we do need to be concerned about. I'll check out the scarring and just go through the whole thing. And because you're a new patient here, I am going to have to do measurements. It's just required, as well as pictures. Okay, I'm going to just take a few with our fancy camera over here. That's going to help us have on file images of your face should anything like a brick, a trampoline fall, a horse kick to the face, anything like that happen to you, okay? And I, again, take pride in my work, and I do my best to restore the face should we have to, but I do advise you to be very careful, okay? Because you do have one of the most impressive faces. It's okay that I touch you, correct? Okay, great, because coming to a face doctor, there's a lot of that, so I just expected that you would know. So, along the hairline. Odd there. I'm going to just move your hair out of the way a little bit. Check the hairline. Looks good. Any concerns with hair loss around the face? Okay, because everything there looks good. And as I do the exam and take the measurements, we will find out if any of these things listed here that were your reasons for coming in are legitimate or not, to use it, not the best term, but so just gonna keep feeling along here. Please inform Dr. Brown if there's any pain anywhere at all. Have you ever had any injuries to your face? Okay. Okay, and nothing with the nose? Oh yeah, I'd be able to tell if there were breaks. Fractures, it's healed wrong. My hands are just that skilled, so okay, I'm feeling around the eyes now, so if you would feel comfortable closing your eyes for me, that would be great. Just gonna go around the brow bone first. Feel the opening of the socket here. brought her dog to the office again. I'm so sorry. So I can't remember if I mentioned or not, but my assistant Josie is out today. So I will have to take the notes and everything. Write it all down because my scribe is not here. Okay, make sure your eyes are closed. I'm going to run over the lids. Okay, feels good there. My scribe. She's not here. No. No, she went horseback riding. I was very concerned about that. After the number of horse kicks to the face I've treated, it's just become a fear of mine, those horses. I'm going to feel your cheekbones now, so just relax for me. So no injuries to the face whatsoever. Perfect. That is great. I just again have to tell you, you have a remarkable face. It is truly one for modeling. In fact, I don't know if this is too forward, but we do need to replace the posters in our waiting room, in the lobby. Yeah, you saw those. Those are kind of old. I would be honored if I could have some images of your face to post, as long as that's okay. I'm going to start feeling the jawbone here along the bottom. Good there. Thank you, thank you. No, your face will brighten up our office, I promise you. Alright, go ahead and look up for me. I'm just going to feel along your neck, because the neck is connected to the face, and while I do only treat to like here, I still need to check in case I need to refer you to someone. Okay. Yeah, that feels alright there. Any TMJ with your jaw there? Have you had your wisdom teeth removed? Okay, alright. Yeah, so that all checks out as well. Now, I am going to bring in the light. I have a regular light and a red light. I'm going to begin with the regular one. The red light's more for like sensing the sun damage in our office anyway. Alright, let me take a look at this scarring now that I've got the light. Okay. Yeah, there's a little bumpage going on there. Let's check this side. Again, slight bumpage. That's normal. Like I said, Dr. Brown has this as well. We have some options for treatment. They don't always work, but it doesn't hurt to try, because for some it does work. Now, let's see. You also mentioned the large pores and the ingrown hairs. We've addressed the scarring. The large pores. Where are you believing that you've got large pores? Okay, so along the nose. A little bit. Okay, a little bit around the nose as well. So let me get up close here. I'm sorry, I have to get very close to see, but there's a little bit. Okay, I'm not gonna lie there. Everybody kind of has that, and I do understand it is a bother to some. We can do treatments for that, but I would recommend a separate visit, as this is the preliminary check, and I had to do some surgical extractions earlier today. That's why we have to talk a little bit quieter. Earlier today, all the tools were involved, all of the tools. So they need to be steamed and cleaned and sterilized, and any way you can sterilize something, they need to be sterilized. It was a horrible show, let me tell you. Dr. Brown performs a lot of different surgeries. That is one of my least favorite. So no, I'm not technically a dermatologist. Specifically, I have to have training in dermatology because I am, of course, working with the face, but for more in-depth things that may be going on with the skin, especially in places that are not the face, I could recommend you if that is a concern. Okay? But you're in good hands with Dr. Brown. I can do what you're asking, just it has to be in a separate visit because of everything that happened earlier. So much mess everywhere. So I do believe that the pores issue, while we can treat it for you because that is a valid concern here, nothing major though to the point it needs to be dealt with today, like the surgery. We can do that for you another time. I am prepared though to do measurements and the ingrown hairs as well. Now let me see, where is that issue for you? Okay, the eyebrows. Let me look again. That might have to be addressed in the next visit as well. I am able to help you with those. Just one moment here. I'm just gonna feel around. Okay. Let me see. Sorry if I have the shakes in my hand. Dr. Brown has had a little bit of caffeine today. Okay, yeah, so I do feel them. I see them around the tail and a little underneath. Do you wax your eyebrows at all? You're shaving them? Okay, so yes, that can remove hair, especially quite quickly if we're looking for a quick solution in a short time span, but that can cause ingrown hair. So if you try waxing, plucking, I'll be doing that when you're in. If you don't traditionally pluck them, we will make sure we handle that correctly, but the shaving is the main concern there when it comes to the ingrown hairs in areas like that. Okay, so I can't believe someone said these things to you. It's just, they're lying. They're horrible liars. Alright, so this is my red light. And again, I'm just going to check for the sun damage here. This one's not too bright, so I hope it doesn't bother you a lot. Okay. Just go ahead and close your eyes. This one's not the brightest, but it's still not always pleasant to have it in your eyes. I'm gonna have you look up, okay? Just look up a little bit for me so I can look at the under eye area. Okay. I see that your cheeks are a little bit damaged from what I'm getting here on this light. Alright, yes, it is common to not reapply sunscreen or forget, or just because those are kind of the places of the face that stick out a little bit farther that you're gonna tend to burn those. I would recommend probably doing SPF more often. Just because the sun is constantly out, we can't really avoid the sun, and while in the hotter months it does kind of get at us a little bit more, it still has the ability to cause damage and potentially cancers and moles. Just different things we don't necessarily want. Alright, so now let's see what we want to do here. Dr. Brown has quite a list of what needs to be done today. So, how about I do the sensation tests first, and then I'm going to test your skin for some absorbency. Yes, don't worry, it's just a little bit of water. There is slight oil in there. I believe it is sunflower oil though, so okay, yes. As long as you don't have the allergies, that's all good here. So for this test, I will need you to close your eyes again. I have this wooden stick here, which will be our sharp, and then I have the cotton bud one here. That will be our soft, or dull, however you like to refer to it, okay? Okay, perfect. So go ahead and close your eyes for me, and we're just gonna... Okay, good. Good. Mm-hmm. Mm-hmm. Alright, and good. Good. Okay, and is this soft or sharp? Good, and does the sensation feel the same on the sides? The nose and the chin. Okay, now for the sharp. Okay. The sensation. Good. Okay, and that did feel the same as all the sharp. Alright, now how about this? That. Okay, great. Now I am going to use the swabs to just take samples of any of your oils that you do have. While inspecting, I did see the T-zone seemed to be quite oily for you. We're going to just test and see if there's any bacteria on your skin that shouldn't be there, and that could possibly be causing the blackheads. can cause infection in any cuts or so that you may experience on your face. We don't want that. Alright, that should be enough. Off later. Now we're going to do temperature, of course. So I'm going to get out one of these little alcohol pads. And this will be our cold, okay? And my hand will be warm. So I need you to just tell me if you feel hot, cold, warm, cold, whatever you want to say that way, okay? Alright, so again, close your eyes, please. How about that? That. Good. 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 Yep. Okay. That seems good there. And because this is an alcohol pad, I am going to sterilize the sides of your face because we will be doing a little bit of work over there, okay? You can open your eyes again if you'd like to, yes. Give this a chance to dry while we do the absorbency test, because I won't touch the sides of your face here for that. Okay, great. No, Dr. Brown does enjoy their job. It's just that medical school really drains the life out of you. Yeah, so let it dry a little bit. No, I would not be doing this profession every day if I did not enjoy it to some extent, okay? Now, we can't get confused there. I take pride in my work, like I had mentioned. So we should take that into consideration when letting Dr. Brown do their work. Now I'm going to just put some drops. Good. Over here. On your forehead, of course. Now we're near what we did. And then down here on your chin. Good. Now, it's okay if that runs a little bit. That's no problem at all. I just need to see how quickly your skin evaporates or soaks up the water and oil mixture. Your forehead's a little more oily. We may see it's not going to absorb much at all, so okay, we have, I'd say, absorbed about 50%. And the chin, I still see a little bit of it just kind of lingering. So sometimes my drops aren't equal, and that's what happens. Let's see. Skin is also different depending on what area of your face of the face you're on, even different places on the body. Did you hear that? The air conditioning in the building next door kicked on. Love that for them. Dr. Brown's writing is such chicken scratch. In the allergies section, I thought I wrote Noel. It says none. Do you know a Noel? That'd be kind of funny. Alright, we're going to move on to the measurements now. Dr. Brown has quite a few different tools. Some of them may look a little bit more scary than others, but trust me, I've put caps on the ends of these because they have sent me really sharp calipers for being a face doctor, and that's a little concerning there, but we won't begin with these. Just wanted to show you everything we're going to be using. The compass to determine distances as well. I can get that was Dr. Brown's issue. I see. Alright, we're going to use the skin pencil. Now, it is a pencil, but it's kind of like the eyeliner pencils where it's soft enough to leave a mark, so this will just allow me to see any markings I have to make between distances, and then I will be using the skin marker, and we will take it all off at the end. I will need pictures with it and without it, in case my notes fail me, because I have to take them on my own today, so we're going to hope that they don't. Josie is usually here. So let's do the centimeter side, just so I know precisely. Okay, so close your forehead from the edge of your hair to the edge of your hair is 15. Okay, perfect. Go from the top, your hairline to your chin. Okay. Let's see, vertical, 3, horizontal, forehead, 15. Going to go from your hairline to your nose. Alright. Into your brow. Slight difference, but nothing major. And your concerns again were the nose, ears, and your eyes. So we will figure that out as we are going today. I do not believe I have my solid ruler here. Pardon, Dr. Brown. Someone's been touching my equipment, and oh, sometimes things go missing. But not today. You're in luck. We'll need that as well. Now, if I'm looking at the top of this ear compared to the top of this ear, everyone's ears are not perfectly lined up. But just from visualization here, I can tell that yours are only points difference, okay? Again, your eyes, to me anyway, from, again, visualization here, your eye line is even and your ears line up right about the same across. So let's just check here from the top of one to top. Okay, so yes, very slightly, but not enough to be noticeable in the way that someone should be saying anything, even though no one should really be saying anything about things like that unless there's a medical issue where something is wrong and things need to be adjusted, you know. But I've heard this saying, just some Dr. Brown knowledge for you. I don't know where it originally came from, but you shouldn't point something out on somebody if they cannot fix it in 10 seconds. Exactly. Yes, so the examples are like if you have food in your teeth, you can fix that in 10 seconds. If your hair has got like a bunch of flyaways like Dr. Brown sometimes does, you know, that can be adjusted in less than 10 seconds. Things like that. Okay, so I'm just gonna eye here. Dr. Brown made it funny. I'm going to eye here the distance between your eyes, as I do have a specific ruler for eye measurements. Okay. And let me get your ears over here. I do not expect them to be the same length either. Again, just points off here. It's not anything crazy. In fact, I can tell you the one is 7 centimeters, the other one is 6.968 centimeters. It's not visually noticeable. Okay. So, and your nose, we will look at that with the solid ruler as well. Oh yes, we were looking at the one eye being higher than the other. Again, this will be better when I have my solid ruler, as that one will give us a straight line. We can line it up with your pupils. Just make some marks here by your mouth. And brow distance here. Let's get that as well. And then the edge of your eyebrow to the top of your ear. is your right. And now I'm going to do a mark just at the edge of your hairline there, your eyebrow. So these markings help me line up, again, for emergency surgeries on the face, things like that. Just gives me guidelines. I hope your visit's a little more relaxing now that we've had the construction workers go on lunch break or something, right? Or whatever they're doing out there. And then we'll do the bottom of your ear to the bottom of your ear here. Okay, and that's, yeah, okay. So let's go from the top of the ear to the top of the ear. Alright, good, good, good. Also going to have to put some dots on your face in some random places once we have these lines and measurements done. Now, what would I like to do? Let's go further around the eyes. Like I said, Dr. Brown has a lot of measuring tools we're going to have to get through here. We've advanced our preliminary visits. Not sure if you were recommended here by a doctor or a fellow human, but we have upgraded and in a way downgraded. It takes so much longer. If only we had the fancy face technology to be able to use the computers to do this for us. But that costs money. Is that Leanne in the hallway? Sometimes Leanne likes to come and bug me. I told her this visit was going to take a little bit longer, but because your face is so perfect, I definitely was shook for a little bit there. My apologies. Okay, so that looks good. That. And then we're gonna get the pupils and there. Okay, good. And that's you staring straight, correct? Okay. Alright, good. Let's edge of the eye. Edge of the eye here. Okay. Good with that. This one gets used more for anything to do with the brows, as it is an eyebrow balancing ruler. But because it sits on your nose, it keeps everything lined up with your nose. Not that way yet. Okay, again, look straight for me here. We're going to line up to eye. Okay, so obviously, again, everyone's face is not a mirror image on both sides, alright? We have a little bit of an upturned corner on this side and a downturned outer corner on that side. Now, that is common. Dr. Brown's eyes aren't perfect either. There are differences here and there. But again, that's only the slightest difference here, where overall the line of your eyes on the bottom is pretty straight. Dr. Brown's is not, I can tell you that right now. But as an example, to like above, open your eyes as much as you can. Not to like a scary point though, you know what I mean, just enough, like your regular resting open eyes. Okay. Yeah, so they're pretty in line, top, bottom. It's just the corners, inner and outer, that kind of make things look a little off. But you can tell your jealous sister that from a professional standpoint, your doctor says there's no wonky eyes here. Okay, good. Now, please close your eyes. I'm going to do down the center of your eye here, now that I have these markings. Do one here, one there, one here, and one here. And that's going to help with centering. And I need double check your ears. Close your eyes just in case I get the ruler too close. I hate when that happens. Yeah, like I said, slight difference in measurement there. But otherwise, that's okay. Now, I'm going to have to measure your nose coming out, so it starts here. Okay, that's average. That's average. Alright. Let me line down the center of your nose. I believe that's everything I need for this ruler. Dr. Brown has memorized all the facial points, but sometimes they slip from you when you're sitting in the moment, you know, making all these marks. You're like, did I do the one on the nasal folds? Did I do one on the Cupid's bow, which is what, you know, the layman's call it, but just so we're all on the same page, I use that anyway. Now this is going to measure for me a couple different things. I know it appears terrifying, okay? It's just gonna get these sides of your face here. Okay, so let me just mark this on the paper with the pen. We do just put these marks over the top of the notes, so that way we have them. By the way, you have a very interesting name. I've never seen it before. No, Dr. Brown doesn't get out of the office too much. Okay, let's see if we've got this lined up here. This also helps me measure it later. Oh, there we go. That's about your face there. Now I'm going to get your nose. Again, don't worry, this won't harm you at all. Just looks scary, but it's really not. And then I'm gonna need the ridge of your nose, which I assume is not as wide as was. There we go. This also helps draw a face quite quickly. I'll show you once we're done here. Now this might get scary, but I'm gonna go by your eye with this. And no, they're not perfectly the same. Okay, I'll have to go back for that one. Let's see what we have here. Alright. What do you do for work? I put that eye kind of far over. Look at that. Dr. Brown's messing up. Alright, there we go. I don't know why I asked you a question right before I'm supposed to measure your mouth, but please hold still just for a second. Okay, thank you. Continue. Oh. And then top to bottom here. Dr. Brown doesn't mean to be nosy, but does that pay well? Okay. No, thank you for telling me. I've got a sibling looking to pursue something along those lines. This brows. All right. Again, no two brows are the same either. Not really gonna measure for eyebrow height. It's not the most important thing, but you know, I'm gonna measure the little center part of your nose here. Okay. Now on Dr. Brown's paper, your face is not going to look perfect. Okay, this again is just the rough sketching. I believe I had moved everything over too far to the left on my drawing, but ears now. Let's check the ear, make sure it matches here to what we have going on. Brow. Check this side. Alrighty. Alrighty. Let's do ear to ear this way. Alright. Just so I have that distance as well. Great. Now I'll go back through with the curved measuring tools and just to do a few more markings so that I can take the pictures. So it's probably hard to tell through all of my writing here, but I do have what would be your eyes, your nose, the brows are at the top, and then the top to the bottom, side to side, the ear to the ear, things like that. I would draw it out for you, but then we wouldn't be able to see Dr. Brown's notes. We just do that so we have the basics to match it to the pictures. There's a lot of cross-checking, things like that. So please stare at this specific mark right here. Let me actually highlight it for you with the skin marker wherever Dr. Brown has dropped it. So right here. Okay, the very faint pink dot. Great. Look at that for me, please. This is gonna measure your eyes. All right there. Okay, the lids. Alright, now again, forward, stare forward. The dot right here. Okay. Looks there. And the roundness looks good. I want to keep an eye on the shape of your eyes just to make sure there's no issues with that. I do have a few eye doctor friends who can assist us with those things should they need to be addressed. So this is also going to look a little scary. You've seen these before probably in math class. If you're around my age or older, I'm not really sure if the younger people are still messing with compasses. I'm sorry, Leanne's dog must have gotten a hold of a sandwich because now it just sounds like a massive dog, but I'm going to place this in the corner of your eyes and measure this out and mark. Great. Same on this side. Good. And then I'm going to go there again, go up to the brow. And back on this side, line this up, go up to the brow. And then I will be putting this at the tops of your lip as such, and going to the bottom of your lip and following along just as much as it is rounded here, okay? Alright, and then I'm going to put it between your eyes, and we're going to go from edge of the brow to edge of the brow. Actually, shrink that a little bit. There we go. Good. Let me just do that again. Sometimes this one's harder to see. Good. Alright. And I think that's it for our compass friend here. Might do the forehead as well. I'm going to put that right in that same spot again. Extend and go up. Okay. Just to follow along the curve. And this is the point where I connect some things now. So please bear with Dr. Brown. Okay. Da, da, da. Alright. Midpoint. Midpoint here. And then I'm gonna get the midpoint here and here. Put it at the bottom of your nose. Midpoint. Alright, I think we're ready for the pictures. I know this appointment has been long enough. May also be because Dr. Brown is quite thorough with everything. I don't charge you extra for the visit if it goes over the hour. I'd rather have things done right than messed up. Oh, we still need to do the treatment on the sides as well. Don't let Dr. Brown forget that, because Dr. Brown will forget that. Okay, the pictures. This is our fancy camera. Now, you may think, wow, that just looks like a ring light. It indeed does look like a ring light, and I'm going to tell you, it partially is. That's how we get the images. So please just close your eyes or stare right through the center and don't focus on the flashing as it does flash. Let me actually see which one. Dr. Brown is now blinded. I'll have to see my eye doctor friends. I think the mid-light is good here. Drop that down. We want it to look quite natural. So this is the, oh, there we go. This is the light that will be flashing, alright? So I'm going to turn it off. I'm going to take at least 2 images forward, and then at least 2 on the side, at least 2 on the side, okay? I don't do any above, but I could, and I could do some from below, just because I'm finding that with the serious injuries like the horse kicks, it would be helpful. So again, no extra charge. Just please stare through the center or close your eyes. Ready? Perfect. And I'm going to back up a little bit and take some images as well because of the posters out in the lobby, okay? Now you can agree to have us not use them, that's always up to you, but I do appreciate it if you are okay with that, comfortable with that. I'm going to take some from the side now, please don't move. Perfect. Alright. And then one more side, let's see. Good. Now let's take from above. Now for these, you can just stare at the panel here. That would be great. Thank you. Alright, and now from below. Situate this. Perfect. Alright, thank you for those. And let me see. Yeah, I'm gonna take a side one again, side profile, just to make sure we have a good image for a poster. So, alright, do you have a side you prefer better? I'd rather, okay, you like this side better. I'd rather do the side you like more. Even though, like I said, your face is quite magnificent, very, very balanced, I would say. Of course, not perfect. We cannot have a perfect face, but in visualization, your face is perfect, okay? Not numbers, not science. Well, maybe it is science, that the whole thing about how we choose partners and things, the faces that kind of are most symmetrical, things like that, you know, it could be science, but numbers wise, obviously nowhere near the same. Sometimes we get lucky with the same sized things on either side, but not everything. So tell your jealous sister that you have a close to perfect face, like the most close to perfect face. If your jealous sister wants to compete, she can come in here, but probably won't treat her as nicely just because of the things I've heard her saying. Kind of disappointing. we'll begin with the treatment now for the scars, and then you'll be on your way. Thank you very much for being patient with me. Now this is a facial roller. It does have tiny little needles on it. As you can see, they're very small. I don't think they would cause harm at all. But, you know, there are horror movies that turn regular things into crazy, scary things. And fall is coming up, so who knows? We might see an attack of the facial rollers or something like that. But I'm going to put a little bit of the drops on your face just to help. You're right, I didn't remove the markings. Dr. Brown apologizes. They're a bit hard to notice just because the pink marker, it's not the best marker, and then that other little pencil, sometimes it just gets lost, especially in this lighting. See, simple as that, just quick removal. Okay, back to the facial roller now, and the drops, level dry. Now this just helps to lubricate the skin so we don't have any, not necessarily cuts. It does create minor cuts in the skin so it can heal. And you'd think, you know, we're treating scars with something that could cause scars, but it is really just a matter of increasing the blood flow to the area so it heals. So we will do this, and if you'd like, just, I could take your hand there. You can barely feel it. They're just like tiny little hairs on here, pretty much. And work that in. So, of course, if this does bother you or hurts you, please inform Dr. Brown, and Dr. Brown will stop it. Just takes a couple of passes. Nothing too crazy. We don't want to be dragging it across the face, you know. But just the right amount to encourage the blood flow. This side's not as bad as that side was from my examination. It all just depends, I'm sure. Well, I would think this side would be worse for me because it was more exposed, you know. Put that away so it can be sterilized with everything else from the other individual. And I will be placing these clear scar sheets over. We will have to cut them down because they are quite big. They're like folded over in the box. And you can do this at home as well. Just apply them to any areas that are a little bit troublesome. It says it's designed for use on larger scars from injury, cuts, burns, acne, stretch marks in general, or cosmetic surgery. So I did use these on my keyhole incisions I had from my surgery, and it did help lighten them up. It kind of just provides the moisture as things are going along. And it also says it improves appearance and texture of old and new scars. So, like I said, always a possibility for it to work for you. If it doesn't, we won't continue with this. In fact, Dr. Brown keeps meaning to try on their own face, but so we will say about this much off. And micro scissors in here. Didn't know Dr. Brown still had the micro scissors, but these will work. Okay. And yeah, they do come in the massive sheets. You can use them. Of course, they come in the massive sheets for if you have a larger scar, but you can cut them down so that they fit the area better. You can also wash them so they can continue to work. If they start to get fuzzy, nasty stuff like that, we don't want to keep doing that. Just for, you know, health reasons and such. So get this loosened, we'll cut it in half. Right. There's a protective sheet over it. Keeps things sterile. And then it's perfect for both sides. Let me peel that back up. So, as you can see, it is just a little silicone sheet, and it's not really, I'd say it's adhesive, but it's not really adhesive because you can rinse it and it'll stick again. You just have to let it dry. So we'll apply this to the side of your face here. Just like that. And again, it's the moisture that is kept inside of them that helps to heal the areas. Absolutely atrocious. Alright, so here we go. We'll just place that on this side here. Okay, and it should barely feel like it's there. Occasionally when I wore them after surgery, I completely forgot that I had them on. And you can leave it on. Let's see what it says. Oh, and of course you should always wash and dry the affected area you're applying this to, but we did that. So let's see, yes, a minimum of 12 continuous hours. So it's okay to kind of forget them on, but let's see what it says. Just daily. You should really try to clean it daily, reapply. And you can use the same sheet for up to 7 days, according to this. Now again, if it gets fuzz on it, things like that, and you don't feel like it's sterile, don't use it. But it is similar to how you can put those acne dots on, and if they're clear ones, you can forget them, as I have also done that. But it is less noticeable then, especially with your hair. On this side of my face, nobody would really know. This side, somebody might see it. So with your hair and everything, you might be able to get away with leaving them on without question. Otherwise, perfect to wear for bed. Okay, yeah, if you're not looking to wear them during the day. Now, we've done everything on my checklist here and addressed your concerns. Let me just pull up the file here. with your name, and the images have uploaded as well, so I'm going to move those into your file. Any other concerns before you leave me today? Okay, perfect. Love to hear it. Did you want to schedule your follow-up for the blackhead extractions, the large pore issue? That it's not a dire issue, and I don't mean that to invalidate you. I'm just saying, like, honestly, compared to the things that I've seen, you have wonderful skin. Again, beautiful facial structure, wonderful skin. Some people would really kill for skin like that. But I'm not going to tell you we're not going to treat it, so. And who knows? You know, we could clear it up. You could be even more stunning than you are now. We'll just have to find out, huh? Okay, so the large pores, that can be fixed with moisturizer as well, just kind of helping. They might just be dried out. I see you are using a moisturizer that you mentioned. Maybe doing it an extra time during the day could also assist, so we can check that when you come back. Alright, so available appointments. We have possibly mid to late October. Okay, is there a specific day you like, a specific time? Let me see. Okay. Does 12 work? Okay. I'll put you on there, drag and drop you. Alright, if anything comes up and you need to move things around, let me know, and we can do that as well. Again, thank you so much for coming in. You have honestly brightened my day, as your face, again, is one of the most spectacular faces I have seen in my office. Just magnificent, okay? And thank you again for letting us use your images for the lobby. It will really brighten my day continuously, and it will show different examples of things we address. I'm not going to put your personal information on there, of course, and I'm not going to mention specifics about what we talked about, handled. I may have them point out the scarring, and we can do a before and after type deal, as long as that's working for you to heal it up. Okay. Alright, yeah, otherwise it'll just be a face. Just be a face in a frame. Side profile. Head on. I'll get these in. And yes, should you have any other concerns or emergencies regarding the face, remember I work with just the face, the whole face, nothing but the face. That is our little tagline here. So, as long as it has to do with the face, I can assist you. Alright, it was an absolute pleasure. Please do come back, even if it's just dropping in for a visit. I'm just blown away. It's an absolute honor to see someone as amazing as you in here. And you're very kind-hearted, it seems. Yes. Thank you again. And I'll be staying in here for a moment as I have to type up some notes, but you are free to go if you're ready, and I will see you in the future, okay? Alright, thanks. Bye. Leanne, that dog was barking during my appointment again. I see you walking by the room, Leanne. Please do not bring the dog to the medical offices. I will have to consider terminating your employment here if you do not follow the rules. Obviously, lots of different surgeries happen in these offices, and you know someone is recovering in one of the recovery rooms. Please do not let the dog anywhere near there, and do not allow it to bark. It's making people jump. Don't want it to mess up any procedures. Okay, thank you. That would be perfect if someone could come get the dog. I am going to have to go on lunch. This appointment ran a little bit over. So when my next appointment comes in, you can either stall them for a little bit or offer that they be taken into a room and one of the nurses start to do the measurements and things. Okay, thank you, thank you. And I'm going to head out now. Okay. Louise, am I in the right room? Okay, thank you. Hello, I am Dr. Brown, and I specialize in the face. Yes, just the face. Whole face, nothing but the face. Okay. Alright, good. And so you're in the right place then. Let me look over Louise's notes. Okay, she checked your face. No lumps, bumps, oozing. Okay, great. Great. Matches her notes here. Okay. Asked about your facial routine. Okay. Some sensation tests. Okay, and I can see she did some measurements, and I have that listed here. I will just be going over a couple of those with a different tool, just to make sure we have the accuracy. You know, it's very important when it comes to your face should anything serious happen. Again, I like to tell people I just recently performed surgery on somebody who had a horse kick to the face, so it all comes down to like measurements and pictures, and we'll be getting pictures of your face as well. Okay, it's all very important. Okay, so yes, you do need some extractions. You can see some of them from here, but trust me, everybody has them, like blackheads, whiteheads, just irritations, things. Okay, so there's nothing wrong with your face. We're just going to do a little cleanup. Okay, all right. Okay, and yes. All right, and we're also, I think we're going to do some dermabrasion to your face, not because it's like you have lumpy, bumpy skin. I mean, look at Dr. Brown. Dr. Brown picked at their face as a child, and this is what we have now. So it just, things happen, but we're gonna do a little something to kind of smooth the skin out. I like to call it sanding the face, but it's dermabrasion. Okay, and nothing scary here, trust me. It's just a little, Dr. Brown can't get the pencil on the clipboard, pardon Dr. Brown. Okay, just a little, it is kind of like sandpaper, I'll show you. See, it's just this little textured spot here. I'll clean it, don't worry. And it just does a little vibration, okay? And it just kind of sands off the top layer with any dead skin, takes it right off. Nothing Nothing like the horse kick to the face type of deal, you know. Okay. So, were you referred here? Did you choose to come here yourself? Yeah, I just like to know the story, so. Okay. Yeah, that's reasonable. Throw some gloves on here. And one moment, Dr. Brown didn't grab a light. Okay. Just gonna do an up-close inspection here of your face. Checking the skin and the problem areas that Louise mentioned to me and listed on the chart. Are you washing your face every day? Okay. Okay. Let's see. I'm thinking I need. Just going to look at some of these. Okay. Yeah, I see like around your nose. There's quite a few. That's common. It's nothing unheard of. And just maybe across the cheeks. Which side do you sleep on, or are you a back sleeper, or are you a front sleeper? Is that what it's called? Because that could be a cause of the build-up in the pores and everything as well. Oh, you are? Okay. Yeah, I would think the pillowcase is causing some of that then. Okay, so this is the camera. It also doubles as a magnifying glass. So I'm going to first just inspect with the light. It is bright. I'm going to put it in front of your face now and then turn it on. You can close your eyes if you need to. Okay. No, that is my white light, okay. Alright. Okay, I'm gonna back up a little bit. You can open your eyes now if you had them closed. And I'll be taking the pictures. Let me just switch to that mode really quick. Okay. And we're going to do a front and then side profile, okay? Alright, thank you. So, again, doesn't matter if you want to close your eyes for this, it does flash, so that is up to you. But I'm going to do this. It doesn't have to be as close. Yeah, I'm just going to snap them now. Okay, turn for me, please. Thank you. Other way. Great. Okay, so those have uploaded to the computer just fine. And that, again, just in case anything traumatic happens to your face and we need to reconstruct, okay? Nothing crazy right now. We also do like to take progress pictures as we do things, so. Let me check that one measurement I was a little curious about. I love my job. Please don't question if I do or I don't. This is just my face. Okay, so patches here, but I'm gonna have to do some conversions because Louise and Dr. Brown have different measurements here. Yeah. Okay, that one was. It's okay. We make the office people do it. Okay. All right, I'll just have them do the conversions for us. But everything should be fine. Just the preliminary stuff since you are a new patient here. Okay. So we're going to move on to the extractions. And so again, that's around the okay. So just along your nose and your cheeks here, just a couple of spots, okay? I'm going to mainly go for the larger ones, but also the ones that look like they're ready to come out. We don't want to force anything that doesn't want to come out, okay? Okay. My fancy toolkit. To open your pores, though, I am going to begin with some water. We're just going to mist it on your face. I know it's quite warm, it's warming up, so pores aren't going to be that difficult right now, but just wanna help them out a little bit. You don't try to do that yourself at home, do you? Oh, okay. Well, let me tell you. That can cause scarring if you're not doing it appropriately, and then we will have to have a more serious conversation, okay? So, just trust Dr. Brown knows what they're doing, and this is probably the safest place to be having extractions done and not in your bathroom on the counter. Okay, let's see. I'm just going to give your pores a moment here. Dr. Brown is once again having difficulty. There we go. So we're going to do a before wipe down of your face and then an after, just to make sure everything is sterile and we do not create new acne that will form right Listen, I have a firm hand, okay? Dr. Brown's been doing this for years now, and I mean business. So, no dilly-dallying here. This does look sharp and pointy. It is, okay? But as long as you don't panic and trust me, things will go just fine, okay? Okay. So what I do with this is just kind of break open that top layer that may be over a black head or a white head. You mainly have black heads. Again, it's everybody's got those. Everybody deals with that stuff. No shame. I see a lot of things in this office, and this is, trust me, this is probably the best you could be dealing with. So I just like to break open that spot in some areas where it doesn't look like it's going to just willingly be extracted. This little doodad, you probably use these at home, or the other ones I have. The other ones, yeah, okay. So it's along the same lines. I prefer this though for the angle and everything, but I just press for a couple of seconds and release it, and all of the gunk should want to just come out on its own, okay? So we're going to just do some gentle presses around, see what comes out, and then we will go around with the pokier tool on the bigger ones that I can see, and we'll get those out for sure, okay? Okay. Perfect. So let's start with this, and we're going to go right here. I'm just going to press, 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 and release. How was that? Okay. Try that again. Press, 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 and release. Just got this in my hand to clean it off. Okay, and then right about over here, we're going to press, 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 and release. Okay, press, 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 and release. You don't want to be too aggressive. You don't want to do too much dragging. The dragging will, again, cause scarring and all sorts if you're a little too aggressive. So, just over here, press, 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 and release. What was that? Dr. Brown has a voicemail. Well, I'm with a patient and I can't listen to that. What was it about? Really? I don't think I need to deal with that right now. Okay, we're gonna try over here. Press, 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 and release. Press, 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 and release. As you can feel, I'm not really dragging this at all, just the press and release, because the pressure of everything around the spot should want to just make it come out. There are a couple though that I'm seeing that do have a layer. So again, just be calm. It's a little poke. It's just enough to kind of break that top layer, but not injure you, okay? Alright. Just a quick little poke. In the nose is where I find this needs to be done the most, so just hold still. Okay, and then I'm going to just take your nose and kind of press it over to the side. I apologize for any dog barks you hear. There's a pound nearby. Okay, same thing on this side, just a little poke. And as you can feel, it just catches the skin to open that area. I don't think I need that anymore. Let's see. So now these bigger things should just come right out. Okay, again on the nose, press, 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 and release. Yeah, a lot came out with that. Okay, yeah, this is working. Yeah, so what we're gonna do after, I'll do the quick little cleansing wipe over your face, and that'll help close the pores back up. And then I'm gonna give you a little bit of a facial massage with the ice globes. They're nice and cold, again, helps close the pores and settle everything and get rid of any redness that may come up as we do this, okay? You don't have too many on that side. If you are a face sleeper, like you say, I'm thinking you go this way and lay on this side. And then, yeah. Okay, press, 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 and release. Just press, 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 and release. Okay. Double check the nose. That looks a lot better. Okay, let me get the ones on the nose that I've noticed. Now I'm gonna move your nose over this way and press, 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 and release. Okay, again, just press, 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 and release. Press, 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 and release. Okay, that looks really good. Trust me, the extractions are the highlight of Dr. Brown's day, can't you tell? Exactly. Alright, so again, just cleansing a little bit. How are you feeling? Nothing too crazy here. Great. Didn't have too many on the chin, but we'll keep an eye on that. Nothing that needs to be messed with currently. The chin's very sensitive. When you try to do stuff like that, it'll just turn into an actual spot, and we don't want that. Okay. Dr. Brown likes to be very quiet when they do this, so please just bear with me. If you want to, you may feel this on your hand. Yeah, see, so it's just like the finest grain of sandpaper that we're just going to go over your face with. Okay. Alright, so again, Dr. Brown likes to focus. Please just let Dr. Brown focus. Okay, don't move. And we're done with that. See, quick and easy. No pain at all. Use that to wipe again and just clean off anything that may be loose on the skin. Alright, see, quick and painless. Just a little vibration. Just a quick little freshen up. Your skin's gonna feel a lot smoother after that. Okay, the globes have been chilled and they are ready to go. Okay, just relax now. You can close your eyes again, get comfortable, and I'll begin the massage with the globes. Again, just gonna close the pores up and settle everything back down, the redness, any possible irritation. Yes, I know, it's quite relaxing actually. I'm going to go under your, I'm going to go along your jaw as well. Just part of the massage, part of the deal. Okay. And along your nose here. Okay. Just quick and easy. The coolness does wonders for the skin. Do you ever chill any of your facial rollers or anything? Yeah, it really does make a difference with like puffiness in the morning and such, so I'd highly recommend it. But that is everything, so if you have any concerns, of course, come back, but as of right now, everything's checking off. No questions for Dr. Brown? Great, love to hear that. And if everything is all good, I hope you enjoyed the rest of your evening, and you can of course come back if necessary, okay? Alright, bye.